If I asked you what part of your body diabetes affects, what would you say? Most people would probably say blood sugar, and they would be right. But one of the biggest mistakes people make with diabetes is assuming that if they feel okay, everything must be okay. The truth is, diabetes can affect much more than your blood sugar, including your kidneys. And that's what I want to talk about today. Diabetes is the number one cause of chronic kidney disease, but many people living with diabetes don't realize how closely the two are connected. When we eat, our bodies break food down into glucose, or commonly known as sugar, which is then used for energy. Diabetes is a condition where there is too much sugar in the blood. Over time, high blood sugar can damage the small blood vessels in the kidneys and lead to chronic kidney disease. Think of your blood like tomato juice. Tomato juice flows easily, but when too much sugar remains in the blood over time, it's more like ketchup, thicker and moving more slowly. This makes the small blood vessels in the kidneys work harder. And over time, that added strain can cause damage. But here's what's important. Kidney damage from diabetes usually doesn't happen because of one high blood sugar reading or even one bad meal. It happens when blood sugar stays elevated over time. That's why paying attention matters. Here are some of the most common things I hear from people living with diabetes. My sugar is always around 250. That's normal for me. I don't know why everyone's concerned. My sugar is 300 and I feel fine. I can tell when my blood sugar is high or low without even checking it. If you've ever thought one of these things, you're not alone. But the challenge is that your kidneys don't respond to how well you feel. They respond to what's happening in your body. Because you can't manage what you're not paying attention to. When you start checking and tracking your numbers daily, along with your food choices, medications, movement, and mental well being, you start connecting the dots. You begin to see how your choices affect your numbers. And that's what helps put you back in control of your health. Because what you measure, you can manage. And what you manage well, you can help prevent. In the next video, we'll talk about the second leading cause of chronic kidney disease, high blood pressure, and why it's often called the silent killer. Until then, pay attention to your numbers and remember, awareness changes outcomes.